Hello, everyone. My name is Shelby Riles, and I'm the Middle Georgia Community Liaison at Community HealthWorks. We're a nonprofit organization working to make Georgia communities healthier. And today, the topic of our presentation is cancer prevention. We're going to be covering 8 tips that you must know if you're serious about your health. The first tip is to get regular screenings. Detecting cancer early through regular screenings greatly increases the chances of successful treatment. The goal of a screening is to detect cancer early so that it can be taken care of early. The later that cancer is detected, the more likely that it is that it's developed into a stage that's going to be more detrimental to your health. Screenings mitigate the likelihood of you developing a late stage cancer because screenings are typically conducted before you have any symptoms of the disease. So, in essence, screenings are a preventive measure. You can learn more about screenings in our early detection education video. The second habit that you absolutely need to know is to get vaccinated against HPV and hepatitis B. These are vaccines that decrease your risk of developing some cancers, in addition to their benefit of immunity to certain diseases. Hepatitis B and hepatitis C both increase the risk of developing liver cancer. This vaccine is recommended for high-risk adults, including those who are sexually active, those with STIs, those who use intravenous drugs, and healthcare or public safety workers who may be handling bodily fluids and may have become exposed. Human papillomavirus, or HPV, is a sexually transmitted virus that can lead to cervical cancer. In fact, almost all cervical cancers are caused by HPV infection. HPV infection is also linked to other genital cancers, as well as squamous cell cancers of the head and the neck. The HPV vaccine is recommended for those aged 11 and 12, but can be finished up until the age of 25. Drinking alcohol is another risk factor for developing cancer. Studies show that there is a direct correlation between drinking alcohol and developing 6 different types of cancer. The more alcohol that you drink, the higher your risk. Be sure to moderate and limit your alcohol consumption. This doesn't mean absolutely no alcohol ever. It just means be sure to be responsible and to monitor how much you do intake because it does affect your health. The fourth tip is to avoid tobacco use. Smoking is one of those risk factors that's entirely preventable. Smoking not only elevates your risk for developing lung cancer, but it also has a negative impact on your health overall, and therefore increases your risk for developing any cancer in general. Using tobacco has links to numerous types of cancer, including, but not limited to, lung, mouth, throat, larynx, pancreas, bladder, cervical, breast, and kidney cancer. In addition, exposure to secondhand smoke elevates your risk of lung cancer. Avoiding tobacco or deciding to quit can significantly reduce your cancer risk. Number 5 is to protect yourself from the sun. When considering your risk for skin cancer, the most obvious way to decrease it is to practice sun safety. Avoid the sun at its highest points. Staying indoors or using sunscreen when outdoors during the hours of 10 a.m. to 4 p.m. is recommended to avoid the sun's rays when they are the strongest. Stay in the shade when you're outdoors. In addition, wearing sunglasses and a wide hat are recommended to increase shade coverage, especially in those hotter summer months. Another thing you can do is cover exposed areas of skin. This will limit the amount of rays that reach your skin. Another one, obvious, is to use an adequate amount of sunscreen. Using a broad spectrum sunscreen with a minimum SPF of at least 30 is important, and you should reapply at least every 2 hours. Consider more often if you're doing an activity like swimming. Avoid using tanning beds and sun lamps, as these are just as damaging as natural sunlight. The most important key here when considering the risk from the sun and your risk for skin cancer is just to be smart about it and to be safe. Sunscreen can make a world of difference. Number 6 might not be any surprise to you, but it's to eat a healthy diet. Diet has a large impact on your health overall, and it's important to consider in your journey with cancer prevention. Basing your diet around proper nutrition is crucial for maintaining personal health. Eat plenty of fruits and vegetables and other food from plant sources. In addition, limit your consumption of overly processed foods and particularly processed meats. It has been concluded that consuming large amounts of processed meats increases the risk of developing certain types of cancers. In general, I like to recommend visiting MyPlate. It's a really good website that you can use to customize your meal plan for your personal needs, so you can really ensure that you're doing what's best for your body and your goals. Number 7 goes hand in hand with number 6, and it's just to exercise regularly. Being physically inactive is a prominent but controllable risk factor for the development of cancer. In general, those who are not physically active are at increased risk for developing cancer, as well as many other types. Doctors recommend individuals should exercise about 30 minutes a day. This could be a brisk walk outside, a power lift at the gym, a short yoga session in your living room, or whatever else you desire that gets you up and moving. Exercise does not have to be an activity that you dread. In fact, exercise releases hormones such as endorphins, adrenaline, dopamine, and more that are associated with the feeling of happiness. Even if it's just a little bit a day, get started and get moving. It's going to be better for your health overall. Number 8 is to maintain a healthy weight. Being overweight puts someone at an elevated risk than those that have a healthy weight. Maintaining a healthy weight is important to mitigate adverse health effects and is crucial for reducing your risk of developing cancer. This is particularly true in the case for women following menopause, as well as men later in life. Exercise can help with this, as can eating well. This applies for both underweight and overweight individuals. Aim to achieve a healthy weight and a healthy body mass index, or BMI, to keep your body in the best state you can. About 45% of cancer deaths are preventable. Prevention has many layers to it, and it is directly influenced by personal behavior and lifestyle choices. In addition to behavioral changes, you can adopt other strategies for cancer prevention, which include receiving vaccinations and routine cancer screenings when appropriate. These are the points we covered in this video, so watch again if you missed it. Each of the tips that we covered today are personal. Each of them you must choose to implement and you must choose to commit to in some cases. This isn't something that you would do for others. Improving your personal health is a task that you must do for yourself alone. If you find that you are lacking in one or more of these points, that doesn't mean that you're doomed. Begin to implement them slowly and incorporate them into your life over time. If it's best for you, choose just one to implement and stick to it. After mastering that one, select another to add to your routine. If you'd like to talk about ways that you can better improve your cancer prevention habits, feel free to reach out using the information here on the screen. If you'd like to learn more about cancer prevention or other health-related topics, visit our website and don't forget to follow us on social media.